The result for many of our healthcare provider organizations has been a huge hit to their operations and to their cash flow. To make sure these organizations can continue to operate and continue to meet the astronomical demands that we are placing on them, we plan to invest $800 million into the Commonwealth's healthcare providers. This funding will support hospitals, nursing facilities, primary care providers, behavioral health providers, and long-term service providers, and supports for other providers impacted by COVID-19 and the health emergency and many of the declarations, orders, and decisions that we've made and issued. More than $400 million will be allocated to hospitals, more than $80 million will go to nursing facilities, and more than $300 million will be allocated to other healthcare providers that are delivering medical care or providing services that keep residents safe in their homes and out of the hospitals. It will be distributed starting this month, April, through July. We were able to pull this critical funding together largely through offsets by reductions in mass health and enhanced federal revenue, and we want to thank our colleagues in the legislature who we engaged in a discussion with this prior to making this announcement and going forward with this proposal. The funding comes in addition to the $290 million in immediate cash relief and $550 million in accelerated payments to providers that we announced earlier in March. As we continue to navigate these unprecedented times, our administration will keep doing whatever we can to support the healthcare workers who are keeping us all safe. With respect to testing, as you know, we've been working aggressively to expand capacity here in the Commonwealth and are continuing to ramp up our efforts. Massachusetts is now one of the largest and most expansive testers in the country, and testing is going to be a huge part of how we develop strategies to deal with this virus going forward. We're incredibly grateful to the public and private labs and healthcare partners that have allowed us to dramatically increase our testing capacity and our output. In addition to the state lab, there are now 25 public and private labs testing in Massachusetts. As of yesterday, 76,429 patients have been tested, with nearly 4,500 new tests reported in the previous 24 hours. We're making a lot of progress, but we also know there's much more to do. This weekend, Lieutenant Governor Polito and I visited a new drive-through testing facility for first responders at Patriots Place in Foxborough. As we continue to talk to our partners at the local level across the state, we're going to continue to add more of these in all parts of Massachusetts. And earlier today, in partnership with CVS, we announced a new rapid testing site in Lowell, which will enable on-the-spot testing and results at no cost. The new CVS site in Lowell will use the new Abbott ID Now test and anticipates being able to test 1,000 people per day and receive the results on site within minutes. People will be able to know if they're positive for coronavirus and take action immediately to seek the proper treatment. Positive cases will be connected to our contact tracing program who will be on site, which we announced last Friday. And multiple language assistance will also be made available. These tests are available for all residents who qualify based on the CVS website's questionnaire, and more information is available at cvs.com. The new test site is well stocked with personal protective equipment, and we're hopeful to have enough supplies right now to get them through at least the next 2 weeks of testing. And we're grateful to the folks over at CVS for getting this up and running and supporting our efforts to expand testing capacity. As we work to isolate positive cases and prevent further spread, we know there's no population at greater risk than seniors, especially the ones who live in congregate care and long-term care facilities. There are roughly 1,000 such facilities in the Commonwealth, so this is a hugely important part of our response to the pandemic. Through the Command Center, the Commonwealth has taken several steps to support congregate care and long-term care facilities. The COVID-19 Command Center has been doing several things to help these facilities prepare as best they can before infections started spreading, and doing everything we can now to help these facilities deal with outbreaks. Should an outbreak occur, the Department of Public Health assigns an epidemiologist and nurses to support the staff who are working directly with the residents at each facility. Today, the Department of Public Health has issued enhanced guidelines to protect the health of residents and healthcare workers and to reduce the transmission of COVID-19 spread both inside and outside of these facilities. We've also significantly expanded our ability to rapid test at each of these facilities. One of the most important things we can do is test this population quickly to identify positive cases and take appropriate action, such as isolation or treatment. Over the past several days, Massachusetts has launched a robust testing program for our seniors to do on-site tests at our nursing homes. It's not only a faster way to test, but it also prevents seniors who may be fragile or ill for other reasons from being disrupted or having to be brought to a hospital or an outside healthcare facility. The testing is being conducted by trained personnel from the Mass National Guard in partnership with DPH and the Broad Institute. These samples are then prioritized for processing. So far, the National Guard has been deployed to 80 facilities across the state and has completed more than 1,350 tests since this program started 7 days ago. Today, they will visit an additional 20 facilities. And we'll continue to build testing capacity in the coming weeks to serve a greater population and support many of our most vulnerable residents. Secretary Sutters will have more to say about this in a second. I want to remind people today, tomorrow, the day after, to stay home and to continue to take the necessary precautions associated with social distancing and following the guidelines that have been issued to keep each other, and especially our most vulnerable members of our community, safe and healthy at this time. We're extremely grateful for everything everyone has done to help us mitigate the spread of this virus in what has been, we would all agree, an incredibly difficult and trying time. The coming weeks will be crucial in fighting this disease and especially dealing with the surge, and we want to thank you for all you're doing to help us and to help your friends and your neighbors and your families. Residents can continue to stay informed by visiting mass.gov/COVID-19, which has been newly redesigned based on feedback from the public to help users find more quickly the information that they're looking for and that they need. And I do want to say thanks to the folks at the Executive Office of Technology and Security Services for their work with the Department of Public Health and our office to launch this redesigned site. It's part of our commitment to making sure that we get important information to the public in real time. And of course, you can always call 211 with questions or text COVID-MA to 888-777 to subscribe to text alert updates, which are now serving hundreds of thousands of people here in the Commonwealth.